Hi, my name is Elias and I'm the Outreach Specialist with the Family Works program. Today, I'm at Kid Smile Dental to have an interview with Heather to learn more about how they work with children and what they can provide to you and help you with your family. Hi, Heather.
Hi.
Can you tell us a little bit more about Kid Smile Dental?
So we are a pediatric dental office. We have a location here in Manteca, which is where you're at. We also have locations in Stockton, Turlock, and Yuba City, and another one coming in Ceres.
Can you go over a little bit of what is the process of the first appointment that a child will go through?
So our first appointment is all about building rapport. We recommend children coming in as young as 1 year old to where they can start getting used to the dental office, get used to the staff. We take some x-rays if they allow us, we clean their teeth, and then we have doctor check for sugar bugs.
What are sugar bugs?
Sugar bugs are our fun little version of cavities.
Do children feel a little more at ease when you call them sugar bugs, or?
They do. They know what cavities are, but it's easier to explain them as sugar bugs because when the children start having pain, we can tell them that the sugar bugs are biting them, and it's easier to explain during the procedure as well.
What documents will the parent need to bring when they do come for their first child's appointment?
So the first visit, we're going to need a copy of their ID as well as the insurance card, and then we have some paperwork for them to fill out.
Why is it important for a parent to take their child to the dentist at a young age?
Because we like to build rapport with them. We want to see the kids before they have an issue to where by the time they need fillings or a tooth extracted or whatever needs to be done, they're going to know us and they're going to trust us. It makes the procedure so much easier.
Does that also help prevent trauma?
It does. Whenever they're with somebody that they trust, and the parents are allowed in the room as well, but they're able to listen to us and know that we're not trying to hurt them.
As of what age can a parent take their child to the dentist? What's the youngest they can be?
We recommend starting it at 1 year old. We're not able to do much, but they're able to see the office, play with the chair, they can get familiar with the staff. The more rapport that we're able to build, the more comfortable they'll be for future visits.
Have you ever had a parent bring a child younger than 1?
We have. Sometimes there's trauma or there's instances where the parents want to get a jump on it and see what they're doing. Most often it's first-time parents, and that's okay too because we're able to help guide them.
What is the importance about preventative dental care?
Preventative dental care is extremely important for the kids. We see a lot of non-fluoridated toothpaste because they're afraid that the kids will swallow it, but we want to make sure that they're on track with preventative care because those habits will be lifelong. If they're used to drinking milk before they go to bed, it becomes a habit, and those things can cause cavities and long-term issues.
What should a parent expect during a dental visit?
For their first visit, it's about building rapport. We attempt to take x-rays if they allow us to. We clean their teeth, have the doctor come in and check for cavities. For treatment visits, we try to walk through, show, tell, do. We show them what we're going to do, we tell them about the procedure, and then we walk through actually doing it, as well as using nitrous oxide and oxygen or laughing gas to help keep them calm during the procedure if they need it.
Is a parent allowed with a child during the visit?
They are. We only allow one parent in the back because our rooms are very small, and of course we do want to get to a point where the children are comfortable enough to be without the parent, but for the first couple of visits we do allow it.
What are all the services that you provide?
We offer preventative services, we offer minor treatment, so for baby teeth we can do anything. When it comes to major treatments such as wisdom teeth or root canals for adult teeth, we do have specialists in the area that we're able to refer to.
When you guys have specialists come in, do they come to the same location like here in Manteca, or do they go to another location?
We send them to another location, but we make sure that they have all of their information.
So it's seamless.
Yes.
Nice. Do you guys work with children with disabilities?
We do. So we see children up to the age of 20, and as far as special needs go, we don't specialize in it, but we try to work with them as well as we can with coping mechanisms and allowing the parent in the room to walk through procedures with them to make it easier.
What do you do if a child shows discomfort?
We try to walk them through the procedure. We take a step back. We let them know that we're not doing anything today, but we try to walk them through what we're going to be doing at the next visit, and we try to figure out what the cause of the meltdown was. Most often, kids are just afraid of the unknown. So we try to walk them through the full procedure, We do 2 attempts. If we have 2 visits in a row where they've had bad visits, to avoid trauma, we'll refer them to a sedation dentist and have them return for their regularly scheduled visits.
Do the children get anything after the visit, such as a toothbrush?
They do. So we try to do positive reinforcement. We offer goodie bags.
Cool.
We get a toothbrush and toothpaste. They also get little prizes like the slap bracelets for the girls or cars for the boys. Where did I put the car? I don't know. We try to make it fun for the kids.
What else is in there? Is there a toothbrush and toothpaste in there too? Or?
There is. There are floss sticks for the little ones that are coated in fluoride. There are toothbrushes that we have for boys and girls. There's also stickers and toothpaste.
Do they get these goodie bags before or after the treatment? Or during?
We typically like to grab them when the kids don't know, to where it's an incentive for them to do really well. So we try to give it to them afterward.
What if a kid gets braces? Is there a goodie bag for that?
Yes, so we do offer orthodontics in our office. Right now we have a special because we are a brand new location that just opened. For any patients that start with insurance or cash, we do offer this goodie bag that comes with an electric toothbrush, mouthwash, toothpaste, and the super floss, along with this little goodie bag. And it gives them a good jump with their braces on how to keep everything clean.
It sounds like you guys offer great orthodontic services here.
We do. So we have an orthodontist who comes in right now. He's scheduled with us once a month. We do an examination, determine if the child needs braces, and if they do, then we're able to offer the metal braces as well as clear aligners.
What do you recommend between both?
Honestly, I'm not a big fan of the clear aligners for children who aren't so responsible. How would I explain that? Basically, it's a compliance issue. If they're able to take the clear aligners out, kids get forgetful. They either lose the trays or they forget to put them back in. So I do recommend the metal braces, but we do offer both.
What does your typical patient look like?
So typically we see younger patients. A lot of teens and young adults don't think that they need a pediatric dentist, but for the children who start at a young age with us, they typically stay with the practice because they're more comfortable here.
What is the oldest patients you usually see?
So we do have an age limit up to age 20. Our office policy here is at age 20, we do refer them to a general dentist.
What do you recommend for a parent to do if a child doesn't want to brush their teeth?
Typically, we recommend making it fun for them. Creston Oral-B has an excellent app to where there are small characters that can interact with them while they brush, to where they're able to brush for the full 2 minutes. And then we do offer different types of toothpaste, usually fun flavors. We'll make it more fun for them to where it can be like a game.
Can you demonstrate a proper way to brush your teeth?
I definitely can, with Timmy the Typonaut.
Hi, Timmy. No, okay.
So you want to make sure that you're utilizing a soft toothbrush. You want to make sure that they're brushing for a full 2 minutes. You want to brush in small circles. You want to brush the top teeth separate from the bottom teeth to where you're able to focus and get all the way down to the gum line. For the inside, you want to make sure that you go through and hit the inside, as well as the tops of the teeth and also the tongue, because we are seeing with more and more children that they're focusing on their teeth, but they do miss their tongue, which will cause bad breath.
How should we brush a baby's teeth?
So for a baby, you can use a regular toothbrush, but typically they're too large. We recommend the small finger brushes. Typically, as the teeth are coming in and the gums are very sensitive, it'll help alleviate the sensitivity if you're able to go through and just gently hit those areas with your finger.
What should a parent look out for in a cavity?
So we see a lot of parents who come in because there are holes in the teeth. A cavity is typically a dark spot on the tooth. There are stains that could be present without it being a cavity, but if you do see dark spots on the teeth, you do want to bring them in to where you can have a dentist take a look.
How would a parent know if there's something else wrong with their child's teeth besides cavities?
You see a lot of swelling issues. We've seen children who come in with cellulitis where they have an infection, so you always want to keep an eye on them and also make sure that they're eating at a regular rate. Sometimes whenever kids start having tooth sensitivity or pain and they don't want to go to the dentist, they won't tell their parents. so you definitely want to monitor them.
How often should a parent brush their toddler's teeth and gums?
We recommend twice a day. Just like with regular kids and adults, we want to get them into that regular routine to where it's a lifelong habit.
What are some abnormalities that parents should look out for?
So we're seeing a lot of decalcification that's common with kids, white spots on the teeth. These aren't necessarily cavities, but they are spots where the enamel is weakened, so they are more prone to get cavities. We definitely recommend coming to a dentist to get them checked out.
What do healthy gums look like?
So healthy gums are typically light in color. There's not going to be any swelling, and the gums shouldn't be bleeding when you brush or floss. In the beginning, if you are getting into the habit of it, there may be some light bleeding. After a week, it should subside.
How do we prevent tooth decay?
Brushing twice a day, flossing twice a day, and using a fluoridated toothpaste. If your child is at high risk, then we do recommend using a fluoridated mouth rinse after they brush.
Can you please explain the importance of taking care of baby teeth to adult teeth?
It's extremely important because the baby teeth are the foundation of the adult teeth. Things like cavities can cause infection and it can affect the bone. That is the foundation for the adult teeth.
What happens if a child has a lot of bad baby teeth? Like, what will happen to the adult teeth?
It destroys the bone, and then as the adult teeth come in, they're not going to have as strong of a foundation. The child can have perio issues from a young age, which can cause long-term issues.
Does baby bottle tooth decay affect adult permanent teeth?
Yes, so in the same way that cavities can, the long-term issue of the cavities affecting the bone can cause lifelong issues for the adult teeth as well.
Does Medi-Cal cover all service available at this office, including sealant to prevent decay?
Medi-Cal does cover most services here in our office. Rarely will we recommend something that's not covered by the insurance. Medi-Cal is an excellent program. They do require that things be a medical necessity, so procedures like sealants are only covered for adult molars. They don't cover it for baby teeth. But the only thing that they have difficulties with approving is our orthodontics. So for braces, they are covered with Medi-Cal, but only if it's a medical necessity that affects their speech or their eating.
How often do you recommend a child's dental visits?
So we recommend keeping them on their regular cleaning schedule every 6 months. Sometimes we will require additional visits for treatment like fillings, but we want to make sure that we keep them on that regular 6-month cleaning visit to make sure that there aren't additional cavities and to make sure that their teeth stay nice and clean.
During the pandemic, what are some of the safety measures that are being provided?
So in addition to our regular infection control, which we keep very strict around here, we have our staff wearing level 3 masks, which is the highest level that you can get below an N95, as well as wearing face shields and utilizing the social distancing.
How are you ensuring the safety of patients?
We're limiting the amount of chairs that we use. We're trying to space them out to keep cross-contamination to a limit, as well as utilizing our closed rooms for any procedures that involve aerosol.
What should a parent expect to do differently now during the visit due to the pandemic?
Unfortunately, because we're limiting the amount of chairs that we use, the wait times may be extended as we continue to grow in our practice, but right now we are limiting our schedule. So the appointments may be a little further out.
How can parents reach out to Kids Smile Dental if they have any questions about the way you guys work or you're able to accept their child?
So we are on Google, Kids Smile Dental and Orthodontics, as well as our website. You're able to reach us via email or you're able to call the office.
Thank you. Thank you for joining us today, Heather.
Thank you.
If you want to learn more about Kids Smile Dental, go ahead and visit their website, which I'm going to put up right here. And if you want to contact them, go ahead and reach them right here. I'm going to put their information up. But if you have any more questions and I can help you with that, you can go ahead and reach me at 209-244-0135. Again, my name is Elias. I'm the Outreach Specialist with the Family Works program, and it was nice meeting you. Thank you. FamilyWorks does not support or promote only one particular place. This video is an example of what services Kids Smile Dental provides to children when accessing dental care. For more information on Medi-Cal, Denti-Cal providers in San Joaquin County, you may call 211 or visit SJ Teeth at www.sjteeth.org, which has a dental locator page with local providers. You may also call Community Medical Centers to schedule a dental appointment at 209-639-5555 or visit Smile California at www.smilecalifornia.org, which contains information on services and providers for Medi-Cal beneficiaries throughout California. Thank you.